Welcome back to Good Morning Sri Lanka. Earlier on, before the commercial break, we were talking with Dr. Channa Pereira about an issue that's of very significant importance. Now, yesterday on the show, we spoke about gender discrimination and gender-based violence. Now, today we are focusing more on child abuse and sexual abusers. Now, Dr. Channa, as you were mentioning earlier on, right before the break, some of the cultural setting and the stigma that's prevailing around this issue. Now, going forward with that, if you'd just like to mention some of your personal experiences where these things have come into play.
Yes, as I told you before, the abuser is in the close vicinity of the child, maybe a close relative. So we come across so many cases in our day-to-day practice, and recently I examined a child, a 14-year-old child who had been sexually abused by the father. And she was subjected to chronic sexual abuse during a prolonged period of time. And I examined this child about 6 months back, and unfortunately, recently she came pregnant. So she was made pregnant by her own father. Now, so who is going to be the father of the child? So these are the problems that we come across. And also when it comes to the male sexual abuse, because it's not only the girls who are being sexually abused, and the male children also are being subjected to sexual abuse. So recently I examined a child who had been sexually abused by a priest. So this is not, I would say, uncommon, but the reported cases are less. So the children and also the parents should be very careful when they bring up their children. They should think that the society is different to the society that they were brought up, and they should be well aware, and they should look after the child very carefully, because I'm repeating, the abuser may be a close relative.
And in most cases tends to be a close relative who the child actually trusts. Exactly. And like moving forward, one of the key solutions to this problem, a lot of people agree, is educating the key groups and the key stakeholders of the child. So what, in your opinion, are the steps that we can take to educate, and who are the main categories of people that should be educated in this manner?
Yes, education wise, we should educate all stakeholders. And now, first of all, we should educate the parents, and we should educate the children. I think we have to go to schools and conduct programs to educate the children, because one of the other aspects is that when it comes to a female child, the child who is below 16 years is unable to give consent by law to have a sexual relationship, because it is assumed that a child who is below 16 years is not mentally sound to give consent for a sexual relationship. And so we have to educate the male as well as female children that sexual relationship is prohibited even with your consent if you are below 16 years. So we have to educate the children, we have to educate them about the legality briefly, and also we have to educate them about the body to them, because the small children who are in grade 4, 5, 6 may not be thinking that sexual organs are meant for a particular purpose. So even at that age, I think we should tell them the difference between the hand and the genitalia, and subsequently, step by step, we have to educate the elder children more about the law, more about the consequences of having sexual contacts. It may be, your image may be tarnished, you may lose your virginity if it's a female, and also you may acquire sexually transmitted diseases and you may get pregnant. So this is very serious when it comes to a child. Assume that a child who is 14 years getting pregnant, and in fact I have seen the 12-year-old children who are being pregnant even by fathers. So this is very unfortunate. So we have to educate the parents, children, and also when it comes to parents, we have to tell them that the abuser may be in the closer vicinity, and also we should educate the parents how to use the technology, the TV, cell phones, mobile phones, the computer and the internet. My personal belief is the internet should be given to a child with the supervision of a parent. And also, I strongly believe at least up to grade 10, the mobile phones should not be given to children, because by using the mobile phone, the child is able to access the whole world.
Exactly.
By stationed in one place. So it is not being filtered, not being scrutinized. So other than these two categories, the parents and the children, I think the abusers should be taught about this, because sometimes the public may be unaware, but public may not know the punishment for this and the consequences. And also we should educate also the doctors who examine these children, and we have already commenced certain workshops to educate the children how to examine, how to address this, how to talk to these children. And in brief, the whole society should be educated on this.
Definitely a few unfortunate stories that we heard by Dr. Chandra. Now also a topic that's interconnected, in my personal opinion, is domestic violence, simply because it is when the social setting of the home collapses that children look for other sources of comfort. Now talking about domestic violence, what in your opinion are the main causes for domestic violence?
Yeah, the main cause for domestic violence is alcoholism. When the alcoholic father comes home drunk, he will abuse the wife. Then of course we call it wife battering, and also the children. Alcohol, drugs, narcotics, and also the absence of single parent. Sometimes the father may be looking after the child, mother may be working in abroad. So all these comes to increase the number of domestic violences, and also gender-based violences, wife battering.
Yes, exactly. And talking about domestic violence, usually, as you mentioned, one of the main causes is alcoholism. Now, maybe prevention methods can include awareness, obviously, but awareness in itself might not be enough. There should be a support network around who will probably have to intervene at different points.
Yes, first of all, there should be barriers for the people to use alcohol, and also we should educate them the complications of using alcohol, the diseases that you can acquire, and also there should be some forms of punishments for these as well. And also, if the person is addicted to alcohol, certainly the best is to refer this person to the consultant psychiatrist for counseling and rehabilitation.
Yeah, exactly. And also when you take a look at adult abuse, it differentiates from child abuse, because as you mentioned earlier on before the show, the part of neglect does not come, but then the rest of the parts are still there. Now talking about sexual abuse between a married couple, it's very, maybe to a layman's eyes it might be difficult to define this, but from a medical officer's point of view, how exactly do you classify it as an abuse or not?
Yeah, I would like to start with an example, because now when I was in Negombo General Hospital, still I can remember, I had to examine a woman where her own husband brought a dog to her residence, own husband, and he insisted the wife to have sex with the dog. And in fact, there was evidence of penetration of the woman's vagina by the penis of the dog. So this is a very serious, unfortunate form of a sexual abuse by the husband. The abuse is not the dog, it's the husband. So we come across these, the wives are being battered and sexually abused by the husbands.
Yeah, exactly. So, and as you mentioned, definitely horrific stories, and people can't even begin to imagine that someone that you decided to marry would actually go on to do something like that. But moving on, now domestic violence and child abuse, how directly or indirectly are those two topics connected?
Yeah, when it comes to domestic violence, one form of domestic violence is wife battering. When the husband abuses the wife, it is wife battering. But when it comes to the other members of the family, if the father is battering or sexually abusing the child, that is also a form of domestic violence which occurs within the domestic environment, which amounts to child abuse. So especially when the father is an alcoholic, which is the commonest scenario, and when the mother is abroad, the children are being subjected to various forms of physical as well as sexual abuse, and eventually neglect. And also when all these forms comes together, the children are being psychologically abused. When it comes to domestic violence, since you mentioned, domestic violence also can affect physically, sexually and psychologically on the woman.
And as a medical officer, there are a lot of organizations who deal with them, and a lot of activists who try and prevent these kind of things. But as a medical officer, probably your message to the public, and especially to the perpetrators of people who engage in such acts, what will be your message then?
Well, first of all, I have so many messages. The first message that I should give is, when it comes to domestic violence and wife battering, I think the male should raise their voices, because our holiness is the female. So rather than the society waiting for the females to raise their voices against gender-based violence, I think it is the premier duty of the males to raise their voices and prevent gender-based violence, wife battering, and also child abuse. When it comes to the medical profession, actually, when it comes to judicial medical officers, I would say in the Ministry of Health, 100% of medical officers are males who examine these. The consultants are males. Certainly, there are female medical officers, non-consultants, who are examining these victims, and also there are specialists. There are specialists, senior lecturers in the universities who are females, who are involved in this as well. So my message is mainly, it's different. My message is different. I request all the male community to raise their voices against gender-based violence, wife battering, and also it will indirectly help to prevent the child abuse as well.
Yes, most definitely. There we go. A very, some of his own experience, which are really an eye-opener as to what really goes on in the society around us, and something that we should definitely take active steps to prevent in the future in order to maintain civic society. And with that, we have to say goodbye to Dr. Channa Pereira. Thank you very much, Doctor, for joining in with Good Morning Sri Lanka, and also pointing to us some key issues that we might have overlooked or we might have not been aware, and making us realize rather the importance of this issue. Thank you very much, Doctor.
Thank you.
So now let's head on to a short commercial break, and we'll be back on Good Morning Sri Lanka.